And one of the tools actually for understanding of these things, of course, is pathology, but that really is the pathology, or the art of pathology, and autopsy, as we discussed before in the first interview, has declined. Hugely important, but a lot of focus on pathology to understand diseases and root cause things, but I don't think it's a big area anymore.
No, it isn't. When I was due to be discharged from the Army, I had previously applied to Dr. McNaught at the University of Colorado for a residency in his department. I went out to see him sometime before, and he said, well, I'll take your application. If you see that list, I'll put it right at the bottom. I said, okay, sir, thank you. So I wanted to stay in Denver because that was where my wife's home was. Her parents were there. I could have gone to Detroit or a couple other places like that, but I couldn't live on $25 a month with a wife and one or two kids. It was impossible.
Yeah.
So there I was. My first assignment was at the pathology department of Denver General Hospital. At that time, Denver only had a total population of around 800,000 people. So it's now 3 times that, something like that, but that was what it was. And people that got sick outside of Denver could still go to a hospital called Colorado General, which was the same idea, but much smaller.
Okay.
So that was a medical situation in Colorado at that time. I come in and I was excited as a dickens. Here I'm going to get a first-hand look at some pathology. Boy, was it first-hand. We had 500 autopsies a year from the coroner's office, 500 a year from the hospital, which gave us over 1,000 autopsies a year to examine.
Wow, that's
And
3 a day.
oh boy, I tell you, they were coming in. Now, Denver was a mecca for several organizations. One of them was a chiropractor who was one of the best advertisers you'd ever want to see. See, the chiropractors in the state of Colorado can practice medicine, they can't do surgery. They can't, I don't think they can write prescriptions either, but they can take real good histories. So everyone that died there had to become a coroner case. Here we got a real good case, he said, and this was extremely, extremely helpful. You were getting practically unadulterated pathology,
Right.
unaffected by anything. You know, there was no chemotherapy or anything else.
Yeah,
So-
no drugging that would affect.
Oh, no, not at this time. Not at this time, no, there wasn't.
That's pure pathology and autopsy.
Yeah.
Wow.
Yeah. So, now, I did quite a few autopsies, and I would fill out the death certificate forms. There was initial cause, secondary cause, but other significant conditions. If there was some other major disease, we'd list it there in regard to that. Other significant conditions, generalized arteriosclerosis. And I thought about this, my God, here we got it on all the cases. I remember what Dr. Eugene Auer, our professor of pharmacology at St. Louis, said when we were doing our injections of guinea pigs to test them for antibiotics, to see what the response was. He said, you observe what happens. If he wiggles his left foot, write it down. You don't know what it is, he said, but someday you might. Later on, if he wiggles his right toe, write it down. Same thing. So I thought about that. That's an interesting thought. Write it down. What happens? We don't know what it is to. But here we got this generalized arteriosclerosis, other significant conditions. It was present in every case of the person 40 or younger.
And they were all of your random people dying for other reasons, not for heart attacks, not for atherosclerosis. But I remember you said that the young people of the Korean War, they had seen this focal atherosclerosis in young people.
Yeah. Well, I don't know how many there were before 40 because we only get a few, and those were people that got killed in auto accidents or something like that.
Oh, yeah.
So, but in those that we did do in regard to, we found that many of them had foci of atherosclerosis. The youngest one was a 17-year-old boy, something like that. So
Wow.
that was exciting as the dickens.
Yeah.
Now, at the same time, Surgeon General of the U.S. Army has people doing autopsies on the young soldiers who expired in the Korean War.
Mm.
And when they found a surprising number of those that had some degree of arteriosclerosis. Isn't that interesting? Young people.
Yeah.
And I said, boy, I think we got something here. What is it? I don't know. We got something going here.
Mm. And did you, I suppose you would have been interested in trying to see, okay, what's special about these people having it so young? What else is different about them? But of course it's very hard to say because they're already expired. You don't really have their earlier blood work or other clues. Yeah. It's just knowing that there's significant atherosclerosis even in someone in their 20s. And yet I guess there's then many people who may be in their 20s who had very little atherosclerosis.
Here's the point.
Yeah, okay.
Here's the point. Dr. Osler, one of the geniuses of diagnostic medicine, he was at Johns Hopkins. His collection of books about like that. He had illustrations of arteriosclerosis. He said it's a very progressive disease, frequently associated with aging. Now, what you may find a person of 60 may have arteries that are calcified, look like they're 80. On the other hand, you may have a very young person who's only 25 who has his vessels sclerotic as if he were 80. Something else is going on here. That was his idea, something else. And he said he thinks it's a congenital variant, whatever that would mean, because no one had any genetics to work with in reference to that.
Mm.
But he said it just happens. That's the cop out in medicine. Well, it just happens. Well, so what do you do? So.
Wow. And it's interesting that now since talking with you and discovering your work in the last couple of years, and also through my sponsor David Bobbitt now, who is interested in promoting the calcification test to catch people early and have a chance to fix them. Lots of people are writing to me now who have had calcium tests, and only 2 weeks ago a young man of 29 asked for a calcification test because his father died at 38 of an MI. So obviously there's a genetic disposition.
Sure.
And the doctor said, no, you don't need it. You're 29, even with the family history. But he insisted, and he got the result, and it was 580, which by the MESA calcium data, he has the arteries somewhere in his 80s. So massive calcification. But I looked at his bloods, and essentially diabetic at 29. Now he had smoked a lot as well, and drinking. But at 29, his blood's going back 3 years. The ratios of his lipids is quite clearly very insulin resistant.
Yeah.
So I guess your opinion is that a large amount of the disease is mediated by diabetic physiology, insulin resistance phenomena. But then the genetic component, I wonder, is the genetic component when some families get really bad atherosclerosis young, just that they're very genetically predisposed towards becoming insulin resistant? So it is genetics, but still the environment
Has to be a
nutritional.
factor, sure.
Yeah, is a big factor. So if you take someone with genetics who can eat a modern diet, high carbohydrate diet with lots of stuff that will tend to promote diabetic physiology, but they may not really develop a lot of it, but then a genetic line that becomes very insulin resistant with a modern diet, it can rapidly develop that diabetes.
Hmm. Well, we get surprised on a lot of things. Actually, because first of all, the medical world really does not know what diabetes is. They really don't. Well, it's high blood sugar. Okay. What else about it? Bike. So, that's where we're at. Now, what happens to the people who have the high blood sugar? They have to be treated with insulin. They have to be brought back under control and so on. You had groups of doctors who were so well trained, so well skilled, that you could monitor them and bring them under control very, very well. And these were considered the diabetologists. Then they would have conferences in which I think this group of people have diabetes too, but the sugars aren't that bad. But they got all the complications as if they were. There was one conference which I attended. It was very interesting. They were having a roundtable discussion afterwards on it. They said, well, these cases have all the appearance of laboratory of being a diabetic. A voice from the audience is called, oh, why not call them diabetes then?
Yeah.
Very logical.
They don't want to call it diabetes unless the sugars are elevated.
Oh, that's right.
That's the problem.
Yeah, that's right. It doesn't fit into the classic definition. Sorry, buddy, it just didn't make it.
Amazing. Whereas in any investigative world, other technical world, you would always dig deeper, say, okay, it doesn't have our classic simplistic definition, but they clearly have symptoms and the phenomenon is happening, so let's look for better measures. But they don't do that.
Should.
I know, but in my world, you always go and go until you get the earliest, and then you know much more what the root cause is when you get to the root. But they don't go to the root. They're happy to sit up here at end stage with high blood sugars and then play with controlling them. It's amazing.
So many in the medical area consider what I call the clinical pathology of diabetes: hypertension, retinopathy, neuropathy, as simply symptoms that occur. But there has to be a reason for it. They are diabetic, and if they have the clinical pathology, that's part of which I just mentioned, they are still diabetic and they should be tested with the oral glucose tolerance as an assay. And they said, well, their blood sugars are normal, fastings are normal. Well, it reminds me of what Athosclerosis did in her work. Athosclerosis was one of the most brilliant Hindu physicians the world had ever seen. She lived around the year 1000. She published extensively. The handful of medical schools that were in Europe were all using her books as part of their text. She was that well regarded. She had one book which is extremely interesting that pointed out the two types of cases that she had difficulty categorizing was this: the people who had persistent boils and the men who could not get an erection. Now, in the Muslim men who can't get an erection when they're entitled to have many wives, that must have been tragic. Can you imagine? This has been tragic. So that was where she left it. Now, she knew nothing about what we're talking about. 1,000 years later, I could have told her what's going around.
Yeah, it's diabetes.
Yeah.
And these would, of course, the boils are the kind of the diabetic problem with abscesses and poor healing. And then the vascular dysfunction then that causes the penile erectile, that's just basically inflammation and damage to the arteries.
That's right.
It just makes them not function so well.
That's correct.
Okay, yeah. And they're all microcapillaries there. It's not it's not just one or two main arteries.
No.
And that it's all the network, and they're inflamed and narrowing, I suppose, with the Because,
At that time, they may have a lot of it there, but no one knows what the aorta is doing or anything else on it. See,
yeah.
so this might be the only focus in which there's a clinical manifestation of it.
Right, exactly.
See, so that is what makes it extremely important to identify or to rule out.
And it could, and for many people, it could be a relatively early manifestation, too,
Sure.
before there's major damage.
Oh, yes, indeed.
And in other people, possibly, we don't know, they could have very significant macro vessel damage and maybe not be too bad there. But it's an awful pity over 50 years that they haven't gone in and done the pathology work and tracked calcification and those issues and just decoded this. I mean, it could be decoded, but I suppose no one really seems to have seen fit to just decode it, understand it, and then move forward. It's always drugs.
Now, pathology has been cut down to practically nothing. However, there's been a good interest in some cardiologists who would obtain hearts of cardiac people at autopsy. And then they would examine it from top to toe. And they found that the extension of it was very, very great.
Yeah.
And the interventricular septum, which causes the difference in rate, was highly susceptible to small capillary damage. So what do you have? You've got a situation there which most people don't pay any attention to.
Yeah.
So most of the doctors don't pay attention to it.
And that is that this inflammatory disease which strains the vessels, those tiny vessels in the septum, the flow through those and how well they function is important in maintaining the beat.
Yeah.
So if they begin to have flow problems, well, unlike say the left anterior descending, or if you get a plaque burst, that's a heart attack one way.
Yeah.
But then problems in many capillaries in the IV septum will just cause a rhythm to go off, and possibly then one of those sudden cardiac deaths that's not an atherosclerosis plaque burst.
That's right.
Clot. And
I think that was the finding of our son Stephen, who was 55. He was living by himself in upstate New York. It was 2 days after Easter, and we get a call from the people who were renting one of his places down the street. Stephen passed away.
oh God, it's been a shock.
That was enough to put me into shock. We went back for his funeral and everything else like that. There was a coroner physician there, a pathologist, who was very good. He said, Doctor, he said, I'll be glad. I'll send you all the findings I have, and I'll pay particular attention to the heart. And he did. And what he found little microcapillary hemorrhages in the IV septum, which is all you need. That's all you need, because you get it off. They're sleeping by themselves. They go out.
And wow, and he was, I think, her fifth of 9 children.
Yeah, yeah.
Yeah.
He was number 4.
Oh, right. You told me last year, I couldn't remember, but
Yeah,
I remember
yeah.
he was somewhere in the middle of nine children.
Yeah.
And so he, again, would it be the inflammatory kind of atherosclerosis type damage to those vessels at the age of 55? Would that also have been an element of diabetic dysfunction causing strain or something?
I think it was.
Okay.
Now, I had him check out his blood sugars occasionally, and he said, well, Dad, they went up a little bit, but they said it's okay. I said, okay. Next time we go around, either there or here, I'll do oral glucose tolerance test on you. Okay. Well, Easter comes, bing, bing, he's gone. So he was a candidate for it, and but he didn't make it.
Oh,
He
yeah.
didn't make it.
I'm sorry. And So he might have had high-ish fasting glucose, or you suspected maybe was he a little heavy, or you had some suspicion?
He wasn't heavy at all. He was
Oh, yeah.
skinny.
Skinny, all right. Well, of course, that's no protection, really.
No, I should
because-
say not.
Yeah.
And he drank too much,
Ah, okay.
and he didn't do anything in moderation.
Ah, right.
He was living by himself,
Mm.
and every other week he would have Ray, who was his son, live with him. And he put Ray on a pedestal, whatever they wanted to do, they would. There was a little river going back in the back of his property, and Steve taught Ray how to fish, and he liked that. Well, we'll see him again. We'll figure out what the hell happened. Well, I look at my life and I realize it's only through the grace of our Lord that I'm here today.
Yeah.
I can't think of any friends I got in my class, college, or anything, who are even alive. I mean, they're gone.
Well, I guess at 95, yeah, it sure, that is an age that the vast majority don't reach. It is.
Very few do.
Very few. Actually, very few, yeah. I don't know what the percentage is, but it's
Yeah.
very few. And how much would your knowledge from 30 years ago, because you have occlusion and the carotid.
Well, this one's completely occluded.
Right, yeah. So, in spite of your knowledge, as you said, you would become a diabetic, you'd fail your own test, just 7 or 10 pounds usually in those periods. Maybe you've moved into hyperinsulinemia, so you've moved in and out all during your adult life. And so you would have built up, some damage. But do you think by knowing what you know, you steered away from it enough times on average to help you live this long life?
Basically, I knew I was a diabetic. I couldn't have these changes without it.
Yeah.
They had to be. I didn't have to have the high blood sugars. I had enough glucose insulin tolerance as you could write a book on it all over the place. So I had the cholesterol studies back and forth in regard to it. That's what everyone thought. That cholesterol, that's the son of a gun.
Cholesterol. They wasted 30 or 40 years
Yeah, I know.
running after cholesterol.
Yeah. So that's what we were.
And while the whole world was running around after cholesterol, which we now largely know is the surrogate for insulin resistance, a kind of a proxy, whole world running after that, and you're there looking at the real deal. And of course, no one's interested. The cholesterol was this cholesterol fairy everyone was enchanted with, and still are to this day. But I guess you, by knowing what you knew, when you did find out you moved into that diabetic state, again, you usually took action and pulled yourself back out of it.
Tried.
Yeah, because it ain't necessarily easy depending on your age. I mean, simply doing a slightly better diet, will help, but sometimes it may take more measures. I know a lot of people now who are genetically insulin resistant, that even lowering carbohydrate, they can still remain not ideal, and they do fasting. Many people are finding that periods of 24 or 36 hours fasting once a week can have a huge benefit beyond just getting the diet right.
Yeah.
And in some ways, I think
It's a good point.
yeah, it can help a lot. Now it's a little more extreme, but people on low carb, high fat diets can manage hunger very easily. Like
Sure.
I myself.
Yeah, they got enough built-in reserve to carry them.
Yeah, you burn fat so
Yeah.
fluently when you're on a low carb diet
Yeah.
for a while that you don't feel the hunger because you're just burning your body fat easily,
Yeah.
smoothly. If all the enzymes are built up to just really do that really well, so you can easily fast and you feel great when you do. So that's another tool. And if you've got the right measurements like yours, the right metrics, don't get distracted with that cholesterol rubbish, and you get the right metrics, you can really apply different strategies, including fasting, and tailor your physiology to be well away from the bad place. I guess that's what a lot of people are in the seminar or the conference I was at in San Diego. You got a few hundred people, half of whom are medical professionals, all sharing, well, a lot of what we're talking about, and getting this understanding spread. We're just going to have to keep at it.
If you note in my book, I stay away from nutritional management as a chapter.
True, yeah.
I'll tell you why, because I could not find one that would be completely universal in agreement.
Yes.
And I didn't want to open up a Pandora's box, because the purpose of my test was not to identify a diet, but to identify an end process,
Yes.
which was arteriosclerosis.
Yes.
That's what it was. No, I've been criticized for that, but what do I know?
Everyone wants the final solution. I think once you understand the disease and you can diagnose it early, then the next step is how do you manage it, reduce it. But the problem, you're in a minefield then, because as you were saying, there are so many opinions and so much controversy. It's a Pandora's box, but the key things are the measurement, the early diagnostic, the understanding of the processes, and the insulin resistance, hyperinsulinemia. Now, what you do to make that process better, that could be it could be different things for different people.
That's right. There you got it.
That's it. Now you're into the genetic variability. Largely it will be lowering carbohydrate will help generally. Some people that won't be enough. Fasting may be needed. There are other things as well, like magnesium is coming up increasingly, and vitamin D to optimize those. And then there's the omega-3, omega-6 ratio, the omega-3 red blood cell index, which is another whole field that seems to contribute to inflammation. If you have too much intake of vegetable oils, the omega-6 type fats, and too low in DHA, EPA, omega-3 type fats, that ratio for a million years of evolution was quite balanced. But we've gone from a balanced ratio to modern people being 40-1 of omega-6 because of all the vegetable oils they tell us to eat for our heart. And that can be inflammatory.
Yeah.
Also contribute. So you're absolutely right. That minefield that's going to have to be debated in the next decade.
I agree.
By tons of people.
I agree.
One man can't do it.
I know. That's why I've been so encouraged what you and your doctor friend in Colorado are doing. They're putting clinical judgment into their work based on what they know about hyperinsulinemia. Now, that is important.
It's huge.
That is important. Because once that can be established, and it can be, I think there will be, like you say, a gradual change. I don't want to see that. I want to see an explosive change. But I don't think I'll see that.
No. But the rate of change compared to the past 20 or 30 years is really quickening, because you had to suffer through, in the 70s, knowing what you know about hyperinsulinemia being the dominant force, this diabetic dysfunction, and the biggest disease, the biggest killer in the world. And then for 30 years, there's almost no proper focus on it. But now in this decade...
Ignored it.
They ignored it.
Yeah.
They looked at cholesterol, and the biggest irony for me is they were looking at something that was the side effect of the hyperinsulinemia. That was the real effect. And they're looking at a side effect.
Yeah.
That the cholesterol is only listening to the orders from hyperinsulinemia, fatty liver, and all that dysfunction. It's a side effect. And they're looking at that. If they looked at the hyperinsulinemia and focused on that, now you'd start seeing what dietary intervention changes could make the really important process get better. And then you've got not just lowered carb, of course, it's more complicated. Some people will need fasting, omega-3, omega-6, vitamin D, and all these other factors can tie in. Heavy metal contamination and genetic diseases. here's one thing that you may interest you. Someone told me a couple of weeks ago, there's a very rare disease, I can't remember the name, where people prematurely age, very prematurely age, quite rare. But a friend of mine investigated papers on it, and well, what's the thing that kills them? And what it is outrageously advancing atherosclerosis. And then he looked through more papers, well, what's uniquely unusual? And there are quite a few blood parameters that are off in them. They have genetic issues. But one of the really striking things is massive insulin resistance. They genetically have massive insulin resistance and massive atherosclerosis. And that's what kills them early. Yeah.
That is a big
So
one.
even in these, I know these are rare diseases and there are a lot of other things going on, but my friend was saying, his name's Nick Mailer, every time you find bad things, insulin resistance always seems to be there. Cholesterol might be low or high, but insulin resistance is so present. So many bad things. I mean, in cancers as well, you know, there's PCOS, polycystic ovarian syndrome, being more and more acknowledged to be essentially hyperinsulinemia. Idiopathic hypertension. Recent papers kind of saying, look, most of this is probably hyperinsulinemia. It's not really idiopathic. It's just no one wants to call it.
I agree with that. I think that's correct.
Yeah.
That's exactly correct. You talk about the people in regard to pregnancies and this sort of thing. One of our doctors on our staff, who was from Spain, he was very much interested in our test because he was doing a lot in regard to fertility studies. And he said, this bit about hyperinsulinemia, he said, was a factor. He said, until they got that under control, he said, their lack of sterility still existed. See, that had to be brought under control.
Oh, so the hyperinsulinemia was the thing you had to fix to have a chance at getting
Pregnant.
getting pregnant.
Yeah.
I think that's a really huge thing because you got the PED, you got PCOS, you got difficulty, conceiving, another modern problem. The cancers, many of them are directly tied to hyperinsulinemia.
Sure.
You know, and this is in papers. You've got the heart disease, obviously, is your one, and that's the massive one tied to hyperinsulinemia. But I mean, I could go on.
Someday you will. Someday you will, because it's the missing link in regard to our entire culture.
Yeah.
And it has to be recognized how powerful this little biochemical substance is.
Yeah.
It's
I refer to it as the master signaler. It's not doing all the damage, but when insulin signaling is wrong, then leptin signaling is wrong. So many signaling systems go off, and insulin is like the quarterback. You
That's
know,
right.
There's lots of players. And
Yeah.
That's Professor Feynman's
I like
phrase.
that. He's
you
a
know?
quarterback, yeah.
It says there's lots of players on the field of chronic disease, and you know, you can't just be monofocus, but insulin is the quarterback. That's the guy to watch. So even if insulin isn't directly driving, like high insulin directly driving a problem itself, directly mechanistically, the high insulin is going with the systemic problem that through some other mechanism is driving. If you follow insulin and get insulin really low insulin, in response to glucose especially, but even fasting down at 2 or 3, and you get a type 5 response with a low carbohydrate diet, you have fixed so much potential trouble for yourself. You know, you've really taken out the big problems. And now you can look for other ones as well if you really want to live forever.
That's right.
That's it. So I think...
Well, I tell you what, I learn more from sitting next to you when you talk than anyone else ever known. I mean it.
You can't say that. Joseph KRAFT cannot say that.
I do. I did say that, but that's true. That's true.
Well, I think I've learned so much from your work, and then I'm somewhat been obsessed, so I followed up leads in many ways. But the other thing is, I'm benefiting from so many people around the world who are doing the same thing, going down this rat hole of hyperinsulinemia and mechanisms, and everyone's reading papers and accessing them on the internet. So like everyone has access to the biggest libraries in the world right at their desk. And these are really driven, motivated people who are technically, astute and talented, and they're aware of the biochemistry and the medicine, and they're going after it, and they're all sharing. There's so much sharing going on that the ideas are getting tuned until you get kind of largely correct. It's great.
It's that sharing which is going to open the doors.
Yeah,
I think so, because sometime there will be something that will happen. Bingo, we got it. Suddenly it's complete, and then they can go on.
And then the challenge, once we're largely if you get enough people each with strong opinions, but they eventually align, all diverse people, biochemists, doctors, all researching and arguing with each other in an open way, not in an academic kind of trying to be right way, but a genuine technical argument. These arguments then all begin to align, and you see a broad truth. And the problem then will be to take that broad truth and then take it outside this small percentage of doctors and people and get it out to the orthodoxy.
Mm-hmm.
But again, the internet will help with that too, because you get more and more recruits, young doctors getting engaged, and then there'll be a tipping point. I'm not sure where, but there'll be kind of a tipping point where it'll get that much awareness in the conversation that there'll just be a tipping point where people can't not listen to it anymore. People will be hearing about insulin resistance, hyperinsulinemia, and they won't be able to stay with the old cholesterol rubbish.
I think you're right. I think you're right.
We'll just keep plugging.
And it's very frustrating to me, but I've come up with this idea through the Holy Spirit. You're not in charge. He is.
I say we are instruments, but we get our talents, and you got to use them.
Sure, that's right.
Yeah, I mean that's what we can bring to the party. We can only do our best, and the rest we'll have to leave to how it works out.
Yeah.
But I think we're entering a good phase, and it's about time. You'd probably say it's been a long time waiting to get into this phase. So that's great, Joe. Listen, delighted to meet you again, and you know what? We'll be swinging by this way. There's a lot going on the next year or two.
I hope so.
Yeah, we'll catch back up again. Have another chat.
I hope your daughter comes in and has a good trip, and she finds a school that she likes, and they'll like her, and I'm sure they will.
Thanks a lot, Joe. Yeah, she's a great girl. We'll see what she decides to do or where she decides to go, but I think this is a field that the next 10 or 20 years is going to get really interesting, so
Sure it is.
it'll be
And look at her background. You. No. I say that meaningfully.
Oh, yeah.
Because you've come through with such a good, clear logic in regard to your thinking. Boom, 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 boom. I just sit back. He's right. I see.
That's huge coming from you, Joe. I really appreciate that. Thank you. So we'll keep getting it out there. Anyway, your interview has 17,000 views, and it'll keep growing. That's the beauty of YouTube. It's not like a television program. It's always there to be accessed, or someone to send someone the link and say, hey, look at this. Keeps on working. Gift keeps on giving.
That's right.
That's the way it works.
That's right. That'll be extremely interesting. Kevin will have to keep an eye on that.